such a huge burden in a hospital setup. Hence, it is a high time that Indians start focusing on Dr. Amirta Ganesh, working in the capacity of Head Department of Cardiology, AIIMS Mangalagiri. He pursued his MBBS from PSG Institute of Medical Sciences and Research, Coimbatore, MD General Medicine at Tanjavur Medical College, Dean and Research, Southern Railway Hospital, Chennai, Fellow of Society for Cardiovascular and Angiography in the field of clinical cardiology, with great passion for teaching, prevention and rehabilitation cardiology, lifestyle medicine, and assessment and intervention of peripheral vascular disease. Let us listen to his wonderful session on lifestyle medication, which is quite important.
Please say happy morning.
Happy morning.
Okay. Nice. Thank you for the nice words of introduction. The reason for the CME is that the moment you start practicing after your finishing your whatever degree you have, whichever field you are in, whether you are medicine or a orthopedician or a pediatrics, whichever field you are, after your treatment, the patient comes and asks you, doctor, what can I eat? Whether I can eat lady's finger or katrika, whatever. But I used to think, how the hell we know? Neither in MBBS, nor in MD, nor in any branch of the field, we have been taught about the importance of nutrition, right? And then we have a separate course for dietetics, and where also there is not much of evidence basis there. So I think we should be able to answer some scientific questions which patients ask. So with that idea only, I was searching for what to do in this. So we have Indian Society of Lifestyle Medicine, and they are offering International Board of Lifestyle Medicine contributed by from American Board. So while reading that, I understood a lot of things which we can implement in day-to-day aspects, and I feel prevention is better than cure. I don't know how many of you know Tamil. In Tamil there is a Tirukural. Idarada Kakum Arivinar Kelli Adira Vermudur Noi. They have started SPM in 3000 BC itself. So whether we can do some lifestyle interventions where we can prevent it, and there are enough scientific evidence to show that lifestyle modification really prevent diseases and reverse diseases. So that's the idea of this conference, and we have a PAN association, Physician Association for Nutrition in India, where they promote evidence-based nutrition in several chronic diseases. So I start my talk with thank you. Thank you Almighty. Thank you Nursing Department and PAN for giving me this opportunity to hold the CME here, and thank you all for coming here. In this note, I want to tell one thing. When I came exactly at 8:30, not even one single MBBS student was there here. My teacher always used to say, the first step in progress of anybody is to be punctual. I expected at least 60% of the individuals at least at 8:30 to 8:40, which you are not there. So I am just suggesting you, try to be punctual. This will carry on your life. Okay? Right. Disclaimer, I have no conflict of interest. I am not against anybody eating non-veg. I am not against anybody eating any product. But here we are going to just tell positive things about whole food, plant-based diet and other lifestyle interventions. How these lifestyle interventions help in managing heart diseases? Any of you know epigenetics? See, for example, if you take a cell from the skin, can you produce thyroid hormone from the cell? Yes, you can produce, right? The same cell is there in thyroid gland also. But only thing is that particular area of DNA, which is supposed to xerox of this thyroid hormone, is being expressed in thyroid. Similarly, in which tissue, what gene to be expressed is controlled by your epigenetic formula, that demethylation, the histone formation, everything. So all those environmental factors, they are proved scientifically, affects your gene expression. So if you modify the gene expression modifications, they modify your gene expression so that you can modify the manifestation of the gene also. That's how it prevents the diseases. So epigenetics refers to the heritable changes in the gene expression that are not due to the DNA sequence itself. So it's only path in between two genes which suppresses or expresses the gene. Our behaviors and environment can cause changes in the expression. For example, modification of the expression of genes responsible for atherosclerosis can be switched on and off. Suppose if somebody smokes, somebody eats lot of unhealthy foods. This particular gene responsible for production of nitric oxide, which is responsible for vasodilatation, is switched off. That gene is switched off, though it is present in everyone. Once you start your lifestyle modification, again this gene can be switched on, which improves your atherosclerosis, which decreases your atherosclerosis. So, by environmental modification, lifestyle modifications, actually it has been proved scientifically you can modify the expression of certain genes which are responsible for your lifestyle factors. Earliest scientific data emerged from this nitric oxide and oxidative stress. Whenever there is lot of bad environmental exposure like altered diet, altered sleep, exposure to healthy and unhealthy foods, patients not exercising, in all those people there is a decrease in the expression of this NO. That's why even we say in heart failure also, when the ejection fraction is very less also, we tell them to walk because increase in activity improves the endothelial function. Because we basically depend on endothelial function because the endothelium has to produce certain substances. If it produces vasodilators, the vessel has to dilate. So all these things are underexpressed in those fellows who have unhealthy lifestyle. This has been proved scientifically. So it is always important to alter the epigenetics by altering the expression so that you can prevent diseases. I want all of you to remember the 6 pillars of lifestyle interventions. What are 6 pillars? Balanced and healthy nutrition. Sustenance. 6, yes, you remember. Regular and appropriate physical activity, sport. We'll talk about it in detail. Avoiding risky substances. Managing ourselves during stress. I don't use the word stress management. We need not have to manage stress. We have to manage ourselves during stress. Then restorative sleep. And then positive and meaningful social connections. These 2 books, I would like all of you to go through these 2 books which changed my understanding regarding atherosclerosis. These are the 2 scientific fellows, Esteemed and Dean Ornish. They have done they are all physicians, MD physicians, who have done extensive research in lifestyle modification, and they have proved clinically, which I will show you now, they have proved clinically, yes, lifestyle modifications can reverse diseases. I just want some of you at least to go through these 2 books which are available, right? The main idea from them started in lifestyle heart trial in the early 90s. They all combined the 4 factors. They decided what to eat, how much you move, and how you manage your stress, and how much love and support you have. With these 4 factors addressed for 2.5 years, they followed up so many patients. And you can see all these patients who was included in the trial, they all had proved block in the coronaries. They all had proved significant block in the coronaries, which cannot be treated either medically or surgically. So, or the patient refused to treat. So these patients are included in the trial. They took care of these 4 aspects and they followed. You can see those who had sticking on to these 4 groups, they had less stenosis. I will show you the angiogram. There was 91% reduction of the angina in the experimental group and reduction in LDL also. Now all of you, I want you to concentrate on this angiogram. This is the left anti-descending artery. This is diffuse sleep. Can you see that? This is the original coronary angiogram of one John Crew, one of the surgeons in US. He was 43-year-old. He was a surgeon, very busy with his surgical work. He was not a smoker. He was not an alcoholic. Because of his bad lifestyle, he had angina. He got admitted and he was diagnosed to have acute coronary syndrome and the angiogram was done. This was the, can all of you see that distal LAD? There is a diffuse disease. After 2.5 years of extensive lifestyle modification, remember lifestyle modification includes not only diet or exercise, it includes sleep, avoiding high-risk substances, managing yourself in stress and positive social connectivity. All these factors are very important. Within 2.5 years, you can see the vessel became normal. There are so many examples. So this is the documented evidence to say that lifestyle modification can prevent diseases. So I humbly request all of you to start your lifestyle modification from now. Definitely, whatever atherosclerosis you can get, it can be reversed. To say data, in these 17 years of experience in cardiology, nowadays I am getting at least two fellows, whether in medicine or engineering, below 30 coming with hypertension, documented hypertension, and many of them CT angiogram proved to have block. The only reason is very bad lifestyle. If you don't take these issues seriously now, you will have MI at the age of 40. Okay, it is reversing now. I am seeing more MI at the age of 40, 42, and I see the children coming and crying with me, and it's very pathetic. Once you have MI and you have LV dysfunction, EF 30%, nothing can be done. So you have to start your practice from now itself, because if you want to advise your patients to follow healthy lifestyle, you should be healthy. You cannot have a stout fellow, BMI 40 sitting, you have to take care of lifestyle, they will laugh at you. This happens so many times. So I want all of you to imbibe this. The main idea of this conference is to imbibe this factor. Some of you may find, may not take it very seriously, may make fun of us. But remember, this is going to a starting point in all of you. The same thing, another patient, you can see the disease in previous and after lifestyle modification, the atherosclerosis reverses. This is by proof in nuclear scan. The first scan shows there is a defect in the perfusion. Defect in the perfusion, you can see in this area before treatment. After lifestyle modification, you can see the perfusion is equal in both the areas. So by all means, they have proved that lifestyle modification can reverse heart disease. So this lifestyle heart trial, which was done in late 90s, was the eye-opener for so many physicians who were interested in preventing diseases. So I just talk briefly about 6 components, 6 lifestyle factors which I enumerated. First one is diet. Whole food, plant predominant eating pattern. Many of you would have heard vegan diet. I am not telling it's vegan. Vegan, you can have unhealthy diets and vegan also. Vegan just means that it's a lifestyle where you don't use any animal products. But I am not here to promote veganism. Veganism is not equal to anything. I want to promote whole food plant-based diet. We have to have plant-based proteins, and there is much evidences to say that plant-based proteins help in preventing diseases. A diet comprised of plant-based foods, no meat, poultry, fish, eggs, dairy and honey. See, you cannot say to a patient that you stop milk, you stop non-veg, you stop chicken. I tried telling this to so many people in Andhra. The moment I tell them to reduce, no sir, chicken once a week sir, please sir, I cannot sir. Many of them are very, this thing about chicken. They started crying. In fact, I told them not to stop, to reduce. But at least 90% of them were not willing. I am telling you, all these patients in whom I advise, they all had undergone any angioplasty or bypass. Yesterday I am seeing one patient post bypass after 6 years, fully smoking more than after bypass. He came to the OP after smoking. I could not even see the patient. So who will take the responsibility? You can do CABG and clap your hands and my CABG, my bypass is successful. But who is responsible for making the patient to stop the smoking? You treat a patient with angioplasty successfully and he comes back with pain, chest pain, you will be depressed. You don't want to see any patient coming back to you with treatment failures. It will be depressing sitting in the OPD. Suppose you have stented 2 stents and the patient comes back with angina, you feel depressed. Did I treat well or not? You go back to the angio and see whether you have done the stent or not. So, it is important for you to advise the patient to modify their lifestyle. Then who will take the responsibility of modifying all these things? It is true that every one of us cannot sit in the OPD and advise everybody. What I am saying is, we have to form a good team comprising of a nutritionist, a psychologist, whoever the team should rotate, and everyone should be advised to take care of all these 6 factors. So, coming to the diet, minimally processed diet, and evidence have shown that following this diet reduces the risk of cardiovascular events. There are so many evidences, I don't want to go into the details of these evidences, I am just showing this. plant-based diet and its effect on CAD, a review. This is in World Journal of Clinical Cases. Extensively they have reviewed and they said plant-based diet is cardioprotective. And this is one of the recent reviews, plant-based diet and its effect on cardiovascular diseases. I'll show you how many studies are there. I don't want to go into the details of the study. But what are the details of the study? You can see plant-based diets decrease the vascular injury because they contain less amount of saturated fat, less amount of sugar and cholesterol. They also prevent in the conversion of LDL to oxidized LDL. You would have read in pathology, this oxidized LDL is responsible for entering inside the cell and make a plaque. So by antioxidants and polyphenols which we have in all the fruits and vegetables, we are preventing the conversion of LDL to oxidized LDL. And then macrophage activation because of low levels of TMAO. So they have proved pathologically by having a predominant plant-based diet, you are reducing all these agents responsible for atherosclerosis and then hence it is protective. So there are so many studies which I don't want to go into the details. So what are the takeaway messages from these studies? Number one, whole food plant-based diet is beneficial. You all will go and explore today about whole food plant-based diet. What is it? It's not equal to vegan. Vegan is avoiding. It's true that we have to avoid dairy and meat. Make less in amount. But just go and read about whole food plant-based diet, which is not processed food. Okay? And proper balanced nutrition is key. Just because we are advising to eat a whole food plant-based diet, you should follow a balanced diet. Sustainability is very important. This point I wanted to again stress because many of you, we go into paleo diet. I go to paleo diet and reduce 12 kilos of weight. And then for 6 months you follow, and then 7th month you go back to the original data and gain 13 kilos. This is what happening in 90% of the individuals because this obesity has a genetic makeup. After 1 year of your therapy as a paleo diet, the body tries to come back to its origin. This is what happens. This is a genetic basis. So, if you are following whole food plant-based diet, it should be sustainable. So, you have to think of all these things. Should be so before advising the patient about the whole food plant-based diet, they should be extensively counseled before implementation and shared decisions should be taken. If you go and read books, Google, anywhere, two concerns about this whole food plant-based diet, one is B12 and vitamin D. People say yes, some vegans and vegetarians, they are deficient in B12. Some non-veg also they are deficient in B12. In India, we have intrinsic factor deficiency. I have done at least B12 levels in at least 16 of my relatives. None of them are B12 deficient. They are pure vegetarian. So, it has a balanced effect. B12 deficiency has both effects. So, you are supposed to check your B12 and vitamin D periodically and supplement accordingly. So, these are the takeaway messages from the studies. So, remember, whole food, plant-based diet predominantly. I am not asking you to stop dairy milk immediately. Just research, explore for yourself and then take a decision. But I want you to avoid that pizza that I am seeing that canteen, near canteen. Somebody going with the tumbler, they'll go in the lift. And then somebody with pizza, somebody with something in the hand, in the brown color, so-called chocolate pie, choco pie, whatever it is. I am seeing daily. I don't know how to advise this. This will have its effect after 3 years. You cannot have a MI at the age of 25. You will suffer. Okay? So, be mindful, take care of your diet. Second is physical activity. Again, many of you may have doubts. We had so many VIPs dying in a gym. So, they have said that no argument, going to gym is harmful. If you go to gym, you will die. No. People are not looking at the other aspect of those people who are going to gym. There are other factors. Just because somebody has 6 packs or 8 packs or broad chest doesn't mean that they are healthy. You have to have a balance between all the lifestyle factors. We don't know what diet they are taking, how much stressful they are, whether they are taking alcohol or not, whether they are sleeping or not. All these factors contributes to your sudden cardiac death at gym. So, going to gym is not the sole cause of death. And remember, having 6 packs is not always healthy. I am not telling 6 packs are not healthy. but you can read about at least 17 people who take only vegan proteins, still having an international athlete, still having six packs. Okay, don't equate those things with the healthiness. So there are four factors which is included in physical activity. The moment we think about physical activity, we think about walking. We always advise our patients, especially cardiac patients, walking and talking. They all just talk something else and they walk slowly. No. Walking should increase your heart rate. That is the idea of cardio. Cardio means the heart rate should increase. How much should increase? It should increase up to 85% of your maximum predicted heart rate. Suppose your age is 20. 220 minus age is the predictable heart rate. 220 minus 20 is 200. If you can achieve 85% of 200, that is called maximum predictable heart rate. So your walking or your physical activity should increase the heart rate by at least 80%, then only it is beneficial. Then this is aerobic. Coming to strength exercise. It's very, very important to do strengthening because it strengthens the muscles. Strengthening muscles always important, which helps in osteoporosis. Even patients with the cardiac failure, they have proved that doing strengthening exercises are helpful. So there are enough evidence to say that all type of evidences you have to prevent heart diseases, like physical activity. Like these are the evidences, and they have shown that who have done proper monitored exercise, they have a reduction in the LDL and reduction in the blood burden. This is one of the latest evidence to show that resistant exercise training in individuals with and without cardiovascular disease, and then they have updated from none other than American Heart Association. The conclusion was, in this study, the dose-response association of this resistant treatment with mortality is linear. As you increase your resistant training, the mortality is very less. So don't divide from doing resistant training. So apart from walking, you have to do strength training, you have to do flexibility and balance also. So all type of exercises are useful. Then coming to third component, avoiding high-risk substances, especially smoking, tobacco products. Extensively, you all know that stopping smoking or using tobacco products helps in heart diseases. But what about alcohol? How safe is alcohol? Is alcohol really cardioprotective? How many of you agree that taking alcohol is healthy? Raise your hands. You can raise your hands, it's in the discussion. Your name will not be displayed in the notice board. Okay. Only 4. Then I take minus. Okay. So if you read textbooks, Google, they say red wine, this, that, taking this amount of alcohol per week is healthy. But that is healthy. Why they are not advising every male and female to take alcohol every week in the American Heart Association guidelines? They don't advise. Because we cannot produce any evidence to say that it is not cardioprotective. So you have to protect other organs also, not only heart. You have to protect your brain, your kidney, your neurons, other organs also. So cardiac protection, that doesn't mean that you are healthy. Okay? So, one of the recent, you can see the vascular effects of alcohol. It always has a damaging effect on blood vessels. So don't think alcohol is healthy. If it is healthy, then they would have advised in every diet, we will start taking alcohol, every one of us will take alcohol after 40 years. No, it is not, it has not come in guidelines. This is the recent WHO in the Lancet publication, 4th Jan 2023. No level of alcohol consumption is safe for our health. Okay, because we are not thinking about other effects of alcohol like cancer. Even small amount of alcohol can predispose to cancer. Because we have all the other environmental factors now which can predispose to cancer. So any amount of alcohol is risky. So no studies that would demonstrate that the potential beneficial effects of light and moderate drinking on CVD and diabetes outweighs the cancer risk associated with these same levels. So no to alcohol. Alcohol consumption is not healthy. Maybe social drinking, it's up to you. But definitely it is not healthy. I am very clear about it. Nowadays there are other high risk substances, usually like cocaine, other IV drug abusers are there. I have seen at least 2 young fellows came with MI at the age of 31 because they are cocaine abusers. So be mindful about it. Then managing ourselves in stress. This is the most important aspect of life. I don't use the word stress management. We should not manage stress. We should manage ourselves during stress. Do we need stress? Do we need stress? Yes, we need stress. Try writing the same question paper after coming home. You cannot finish in 3 hours. So we need that sympathetic drive. So nature or God has given you that stress. You have to convert that stress to you stress. You means good. But we are becoming distressed of it. And everything people, they are taking it as stress. For example, somebody coming from town here, every time, sir, the traffic is so bad. I get stressed. No, traffic is so bad, we know that. Why should we get stressed out of it? Start 5 minutes earlier. The same thing. You are all stressed because today is the CME. And none of you came at 9 o'clock. Because I became distressed. Okay, so how to manage stress? This is a very important component of rehabilitation and prevention. Because we often advise people to reduce their stress by doing meditation. What is meditation? All of you close your eyes and focus on single thought. No, the moment you close your eyes, no, all nonsense thoughts will come. Then you get stressed more. So you do meditation for stress, that becomes more stressful. So according to me, what is meditation? Before doing meditation, I would like all of you to identify what's your passion. If you know what's your passion, if you spend 10 minutes in what you do as a passion, it's a meditation. So don't try to close your eyes and try to focus now. That is after 50 years. It's practically, it's impossible. I'm telling you. So, first, identify your passion. For example, listening to songs, singing, or dancing, or reading, painting. Apart from watching social media, which is not a passion. Okay? So, identify your passion. Spend at least 10 minutes. How to identify your passion? Go today, before 5 minutes, before you sleep, take a small notebook and write something, what you did today. Slowly you will be able to identify what's your passion. Somebody asks you, how are you? I'm fine. How are you? I'm fine. These two are different. The moment you say, I'm fine, you know that you are irritated. So you tend to behave by your thoughts. So what you do, suppose if you want to stop alcohol, if you want to stop social media screening, or if you want to stop smoking, what do? You can take him to your room, tie with a rope, give some nicotine patches for 2 weeks. Will he stop smoking? He may, but it is not sustainable. You have to modify his thoughts. Unless you modify his thoughts, he will start behaving again. So this is called cognitive behavioral therapy. See, core function is what all animals have, which is responsible for your respiration, ventilation, everything. Then came the emotions. You can see dog, cat, tiger, they all have emotions. But they don't think. What humans we got is, we have our thoughts, frontal lobe. So, when you are emotional, the emotional circle will expand, right? It will encroach on your thoughts. When your thoughts are blunted, you behave abnormally. That's why we say, during your extremes of emotions, don't take any decisions. Because your thoughts will be blunted. So, if you want to change your behavior of waking up early at 5 o'clock in the morning, or doing exercise in the morning, taking a breath, so you want to change your thoughts first. When you change your thoughts, then your behavior will change. This concept is very important for each one of you, for yourself, and for treating patients also. So this is called CBT. Your thoughts, you behave by your thoughts. So try to change your thoughts. How to change your thoughts? Start writing. Start auto-auditing yourself, what you do. Then sleep. Usually people come, the first follow-up, they will say, sir, I don't get sleep, sir, I don't get sleep. The moment they say that, no, we add some alprazolam, we add lorazepam, we send them. No, we are not spending time. Why? they are not sleeping? There are so many factors, psychologically, medically also. For example, OSA, they can be snoring. So we have to identify why they are not sleeping. Adding a sedative is not a solution. So sleep for each one of you is very, very important. At least 6 to 7 hours of sleep is extremely important. Try to sleep early and wake up early. Try these things. So, because all the cardiovascular diseases gets precipitated at night. Because when you don't sleep properly, the cortisol levels are very high even at night, which makes the clock unstable. They can have a. So sleep is very, very important. You have to realize from now itself. These are the evidences to say that sleep precipitates things. Then finally, positive social connections. It is not positive social media connections. This is positive social media connection. I am not talking about this. I am talking about this. So, I want each one of you to just have a good interaction with many of your friends periodically. Have a chat, healthy chat without cell phones, without any abuse substances. Talk to somebody. I used to when I was doing a PG, I used to talk every week. Those days only no cell phones were there. But I used to call one of my friends every week or 15 days and talk to them. So try to talk to somebody whom you love periodically and try to express your thoughts. Why this is very important? Because of peer pressure, suppose you feel depressed of something, you don't express it because what he will think. Okay, this one of the examples I can tell you. Some of you can faint during your clinical classes. Because this is because of dehydration, because of functional reactions, and there's a stigma around it. You don't express this to somebody, and everybody will look at you like you are an alien. No, you have to express. Once you have positive social connectivity with people, you will try to express yourself, and this can avoid so many suicidal thoughts. And this has proved scientifically that having positive social connection improves your cardiovascular risk. Okay. These are the take home or hostel messages. Because many of you may not go to home, may go to hostel. These are the take home messages. Be mindful about your thoughts and hence emotions. Many of you may make fun of me because of telling this, but this is the truth in life. And your behavior will change because you are changing thoughts. Be watchful of your dietary pattern. First, be watchful. When you write down, you know how many pizzas and unhealthy foods you are taking. Improve your sports activity, physical activity. Try every day, do some sports, some walking, some strengthening exercises, some stretching exercises. Take a vote that I will not sleep today if I don't do any exercise. Form a group of like-minded people. Somebody who is interested in doing sport, make friend with them. He will pull. Sleep well. Try taking digital holiday. I suggest to everyone, at least on a Sunday, at least half a day. Keep your cell phones, your iPads, your TV, everything switch off. At least spend 8 hours or half a day. You try doing that, you will be euphoric. And then improve your social connectivity, not social media connectivity. Thank you once again.
Thank you, sir.
Questions? I'm sure there are a lot of questions. First I start. It's from me. Actually, you had shown that X-ray now for Dr. What was his name?
John Crew.
John.
He's an angiogram.
He is from
US, California.
So how did he change this thing? Was it only physical exercise? Was it
No.
stopping?
All the 4 components, because he was Dean Ornish, was very famous man, physician that day. He joined in his group. He is strictly a whole food plant-based physician. Don't use any processed foods, oils, exercise. All the 4 components are taken care of.
Which is worse? Is it being non-vegetarian? Is it taking dairy? Or everything contributes together?
Everything contributes. See, there are so many non-scientific bias behind this meat and dairy industry, which when you see 2 or 3 films from the US is there. How the dairy and meat industry modifies the dietary pattern, because out of 20 members of the dietary panel, 11 of them are somehow connected with the dairy industry.
Is it red meat or even seafood? And
Yeah, because nowadays seafoods have become very unhealthy nowadays.
Because of because of?
Because of so many hormones, salt, everything.
But same thing we can tell about plants also.
Yeah, definitely. That's why they are promoting organic. That is why, see, evidences are, again, there are controversies in that. If you Google, still there are some studies which advocate this thing. That's why even in American Heart Association, they are not telling to stop non-veg. They are telling they are reducing meat, in the red meat areas, take some egg and fish. Still they are advising. I am not against all this. Disclaimer, I am not against. But evidences are still far and against. It's my personal experience. When I finished my IBLM exams, I had my triglycerides of 497.
Yeah, we had seen you.
Yeah. 497. Then I did this course and then I tried doing this for myself. My triglycerides came down to 130 after I stopped my milk and milk products. I am from village. Tamil Brahmin, so I cannot eat without curd. Even when I go to North India, I'll search for some curd. But I stopped it. After stopping milk products, my triglycerides came down to 130. My weight reduced by 9 kilos. Still I am maintaining it for the past 4 years. I checked this in my 4 of my patients, diabetic patients. Pure lifestyle modification. I have stopped all the anti-diabetic drugs for them. Still they are without drugs.
That's good. Any questions from the students? No, I'm sure they'll want to ask.
I want all of you to explore this.
If I can just answer your question, was talking about even plants have pesticides and everything, which is true unfortunately. But you have to understand that animals are middlemen, right? What are they fed? They are fed plants, and then we eat the animals. So they are like accumulating all the toxins into them, and then we are feeding the overdose of them. If you go directly to the source, you will get some, but you will get less, instead of getting everything in a concentrated form.
Okay, one question, since you're telling pure vegetarians without lactose, are you saying they'll never get a heart attack? Can you say that?
No, it's not so. Other factors are there. Apart from food, other factors are there. The exercise, it's a sedentary lifestyle, genetic.
It's a complete package, like sir excellently showed. There are multiple pillars of lifestyle medicine. All have to be engulfed. If a person is stressful, he will have some problems. So it's not just that, but diet is a crucial part of it. And we can only try our best to minimize disease.
I think I want to start.
I think a recent Lancet study also has shown that Indians are very unhealthy.
See, all the guidelines, like sir said, nobody is saying don't eat. Because they cannot say that. Even if they want to say, they cannot say don't eat. It will create a huge uproar. Like sir said, everybody on the board is either affiliated to it or they themselves are consuming and they cannot give up these products. So for them to come out with a guideline saying don't eat at all is not feasible. Meat and dairy are the biggest industries in the world today, along with pharmacy, and all are...
Euphoria Mangalagiri Club. Some of you started, I will be a member. We all support each other. Right? Any questions? Yes.
So you told about stopping refined oils, but most of our Indian consumption is refined oils, or cooking isn't refined oils.
There are many books available now, even my wife cooks without oil. And there are so many this thing. And definitely I'll tell you, after reducing oil at least to 60 to 70%, definitely many of my patients' GRD has come down a lot.
So you suggest cold pressed oils or
no oil.
no oil?
Because they say that, what Dean Ornish says that, all these, see for example, peanut is healthy, but peanut oil is not healthy because they are all trans fats taken from peanut. Okay, so that is not that much healthy, especially when you just start heating it. If you can take oil raw a little bit, which is not unhealthy, but when the moment you start heating it, it becomes unhealthy. I don't know how much time they heat in all take puri. I don't know. That's it. And then similarly, I've seen that in elderly, many of them come with a GERD because of lactose intolerance. Lactose intolerance need not present always with diarrhea or vomiting. They typically present with GERD. The moment you ask them to reduce or stop, within 2 weeks they are pretty well. I have seen in my practice many of patients. Thank you, sir.
been in this industry for the last 10 plus years. I know Dr. Ganesh at least five plus years now. You have such a wonderful leader in preventive care here. I should say that a national leader. So do you have anything already running, any kind of clubs or any kind of things which brings these changes, like dietary change, maybe the canteen change, or some kind of group exercises which is happening, or some kind of meditation or yoga which is happening? Okay, what about diet?
No, slowly starting now because only 6 months.
Yes.
Slowly I'm planning to.
I think, Doctor,
Yeah,
because we all have huge respect for you. We need to start the changes in the canteen itself. I think one of the colleges, Dr. They started some changes in the canteen. They have a small canteen for their preventive cardiology department, the inpatients, where they don't.
In fact, he is one of my role models.
Exactly. You also, like all of you guys are like amazing. So I think you should support the mission. Actually, it is a privilege to lead such kind of a life. It's not just about preventing diseases, which is a long way for you. So to improve your cognitive skills, your looks, your energy, your vibrancy, the better you sleep, the connections you make, you become much more happier when you're eating more plants and devoid of animal products. Because that comes with its own set of things other than saturated fat or trans fat or DMA or all. It also has a lot of implementation. Start changing bit by bit. You guys can do wonderful job.
Yeah, we'll meet sometime. Some of you come, we'll volunteer. Somehow you will have to start. Somewhere we have to start. Okay? Ask any questions. Yeah.
Actually, compared to the general population, we doctors need more about nutrition. Forget about nutrition, especially of stress and work hours. If you see common, like average life expectancy of Indian is 71 years, and the average life expectancy of the doctor in India is around 60 years. That means 10 years less than a normal
Absolutely.
Then the main thing here is, if you see nursing officer and all, at least in our hospital, their working hours are around 8 hours and all, and our SRs and PGs will stay overnight and all doing overwork, and even interns will do overwork. Can we do anything about it particularly? And also, if we consider our college, there are no grounds till now. It's like way, and the gym is also not there. And, yeah, I appreciate your. I think before going into the population per se, we have like Indian medical system has to change. Basically the work hours has to be modified. There are.
Yeah, I'll tell you. I'll answer that question. The change should start from you people. Today, I expected everyone to come at 8:30. How many of you came at 8:30? Okay, number one. Number two, yes, this is a growing institute. This is a growing institute. At this age of 49, 50, I have started the Department of Cardiology with a huge workload. I am conducting CME. So each one of us who are like-minded, we are taking the steps. I am calling you also to be responsible for it. Right? See, every center, every institute you take, even you go to Delhi AIIMS, there are some facilities, some plus, some minus. Okay? House surgeons and PGs doing hours duty, it's almost 50% reduced nowadays. During our days to 36 hours. There is no other go. When a patient is dying before, yes, we need to do all these things, but nobody is joining here. For the past 4 years, none of the cardiologists joined here. So we have to change your mentality. Once you go into the field, everybody wants to earn. Nobody is thinking of a satisfied life. They want successful life. How many angioplasties have done? So the change should start from here as a student. You have to start. Yes, I want to have a satisfied life rather than a successful life. I have seen so many cardiologists who is advising stent dying at the age of 35 because they started a hospital, no income, nobody is coming there. So after being in cardiology for 17 years, believe me, I have done all interventions from head to foot. I have done interventions of dorsal spinatus artery. And I have come to a conclusion that somewhere we have to take the responsibility. So we all will take responsibility. The change should start from you instead of blaming somebody. Right? I am not telling your questions are wrong. But who should take the change? Somebody from Modi's government will not come and do a change. We have to start. We have to start. Suppose there are 3 persons on duty. Okay, you sleep for 3 hours, I will take duty. There is no other go. Workload is more. So slowly we are taking responsibility for everything. You know, for my JR also, I am not teaching, I am preaching. I give them adequate space nowadays. The strictness which we had 10 years, 15 years back is not there now. Slowly it is changing, it will change. But when you do that, it will change. For which, many of your right-minded people like you should stay in India.
Yeah.
After finishing MBBS, 8 years away and fly. Because you have a comfortable life in USA, I am in California. And you come here and give a good talk. Welcome, sir. Happy morning, sir.
Thank you, sir, for taking your time in clarifying doubts. Days in nutrition, intervention in clinical practice. Let's begin our today's wonderful event with inaugural session by inviting our honorable guests onto the stage. To invite our honorable chief patron, Professor Dr. Madhavan, to come onto the dais and grace the occasion. I request Dr. Amirta Ganesh, organizing chairperson, additional
Dr. Srimant Kumar Das, Sir, Dean Academics, AIIMS Mangalagiri, onto the stage. I request Professor Dr. Dhanasur Ma'am, organizing co-chairperson, Principal College of Nursing, AIIMS Mangalagiri, to welcome Sir with sapling.
With great joy, I take this privilege to invite Dr. Vinit Thomas Abraham, Medical Superintendent, AIIMS Mangalagiri, onto the dais. I request Mr. Sharang MB, Organizing Secretary, Associate Professor, College of Nursing, to welcome Sir with the sapling.
May I invite the organizing chairperson, today's event, Dr. Amirta Ganesh, HOD, Department of Cardiology, onto the dais. I request Mr. Bibin, organizing member, to welcome Sir with the sapling.
It's my honor to invite the organizing co-chairperson of today's event, Professor Dr. Dhanasur Ma'am, Principal College of Nursing and CNO AIIMS Mangalagiri, onto the dais. I request Dr. Muthu Venkatachalam, Associate Professor, College of Nursing, to welcome Ma'am with the sapling.
With immense pleasure, I take this opportunity to invite Dr. Rajeena Shahin, Medical Director, Pan India, onto the stage and grace the occasion. I request Mr. Harsha, Organizing Committee member, to welcome Ma'am with the sapling. Ladies and gentlemen, we are about to commence our event and thank our Almighty God for all His grace and blessings. It's our honor to invite all the dignitaries on the stage to come forward for the lamp lighting ceremony. I invite Dr. Sharang Wartikar, sir, on the stage for the lamp lighting ceremony. Sir, please join on the stage. I request all students to come and sit in the front rows. Please come and sit in the front rows. The students who are sitting in the back.
All of you come anteriorly. Probably they forgot the medical terms now. Come anteriorly.
India to come onto the stage. I request Mr. Bipin to welcome sir with a sapling.
Witnessing the lamp being lit, may it inspire us all. The flame's upward movement, defying gravity, stands as a symbol of our quest for knowledge, upliftment, and the resolve to rise above light over darkness, knowledge over ignorance. A heartfelt thanks to our esteemed guests for leading this auspicious beginning. As the lamp's light continues to commitment to knowledge, harmony, and progress. With this luminous star, we now officially declare the event open and proceed with our planned schedule. Now, I request Mrs. Komakula N.K. Santoshi, Nursing Tutor College of Nursing, to deliver welcome address.
Esteemed guests, galaxy of intellectuals, colleagues, and my dear students, it's my great pleasure to welcome you all to this significant gathering dedicated to the crucial topic, evidence-based nutrition. Once, Heather Morgan said, every time you eat or drink, you are either feeding a disease or fighting a disease. To eat is necessary, but to eat is an art. The food choices we make daily have far-reaching impact on our physical health, mental health, and quality of life. With the increasing prevalence of diet-related health issues such as obesity, diabetes, and heart diseases, it's never been more essential to rely on rigorous scientific evidences to guide our nutritional decisions and policies. On this auspicious occasion, a very special welcome to our Honorable Director and CEO, Professor Dr. Madhava Nandikar sir, who is an academician, visionary leader, clinician, researcher, administrator, motivator, and an inspiring personality, all of us. We are truly privileged to have you with us, sir, today. A warm welcome to our respected Dean Academics, Professor Dr. Sriman Kumar Das sir. Your presence enriches this occasion and we are grateful to have you here, sir. With a great respect and admiration, it's honor to welcome Dr. Rajeena Shahin, Managing Director, Pan India. Your presence here made this today very special to us, ma'am. Thank you for joining. With a grateful opportunity to welcome our respected Medical Superintendent, Dr. Vinith Thomas Abraham, sir. Your presence today makes this event truly memorable, sir. Thank you for joining us. And we extend our heartfelt welcome to our Dean Examination, Professor Dr. Desu Ram Mohan, sir, and Dean Research, Professor Dr. Deepthi Vepakuma, madam. Thank you so much, sir and ma'am, for your support. We are delighted to have you in our conference. And we are overjoyed to have Dr. Amirta Ganesh, sir, Organizing Chairperson, HOD Department of Cardiology. Your presence brings warmth and significance to this event, sir. Thank you for joining. Let's extend a heartfelt welcome to Professor Dr. Dhanasu R, Principal and CNO, whose exceptional work has made a significant impact. Thank you for joining, ma'am, today. Let us warmly welcome the entire team of Pan India Physician Association of Nutrition, Dr. Sharang Wartikar, sir, for this occasion. Thank you for joining us, sir. And with great respect and admiration, we welcome the PAN Organizing Committee, Dr. Shruti Sharma and Ms. Bhavani. We are honored to have you here with us and looking forward for your invaluable insights. Thank you for joining us. With a great respect, I invite all the faculties and organizing committee members of College of Nursing for today's event. Lastly, I am extremely happy to welcome all the students to this occasion. Your attendance signifies your commitment and support, which we deeply value. Welcome once again, and let's make this event enlightening and impactful to all. Welcome. Thank you.
Thank you, Mr. Santoshi, for your warm words of welcome. The greatest sign of respect you can offer anyone is actually listen to what they say. Now it's time to listen to our dignitaries. With eagerness to hear, I would like to invite Dr. Rajeena Shahin to share her thoughts.
And I always say that it's actually, for me, it's a privilege to be standing here with so much of intelligence in one room. You guys are actually gone through multiple preparations and to get into this kind of an institution. And you have such wonderful leaders who is training you guys to become real healers, real doctors. As Dr. Amirta Ganesh in the speech said, success is not just determined by the kind of money or the kind of procedures or the kind of papers you do. It's determined by the quality of life you live, the quality by which you are able to help your own peers, your own family, and your own people, patients. That's what is more important. You must be knowing that there are quality of life index which is becoming very popular. In India, we are actually in the lowest part. Do you guys know which all countries come in the first 5 or 10? Anybody? Happiness index, quality of life index? Yeah, it used to be Bhutan. Right now, it is all the Scandinavian countries actually. So because the kind of life they lead made it more meaningful actually. So that this is what I want to communicate. Today's take-home message is actually start taking steps to lead a more healthier, meaningful life. Changing your nutrition or lifestyle, dietary pattern, and incorporating all the other lifestyle elements which Dr. Amirta Ganesh has already spoken with you guys. So that's a message we are all going to pass. It's not just a lecture which is going to talk a lot of science and stuff, it is something which will help you to start thinking about your own lifestyle and start helping change your lifestyle, which will also have a larger impact on the society. Thank you all of you for coming here and listening to us. Let's also build a larger community of young leaders who can really take this moment forward. Bhavani and Shruti can definitely help you with forming a group. We have multiple association groups in med schools, AIIMS, June'24, and different colleges, right? Around 8 or 9 colleges. So we can form a group here and we can definitely help you guys lead this movement in your college. Thank you, thank you.
Thank you, ma'am, for your motivational speech. Now I request Dr. Sharang Wartikar, Pan India, to deliver his speech.
Thank you so much for inviting us over here. And somebody was mentioning about the campus and stuff like that. I've done my MBBS from KM in Mumbai, KM College, GS Medical College, and the campus there is probably considered to be one of the premier institutes of the country, and the campus is probably, I would say, like 20% the size of your campus. So I think you are quite lucky in that sense to have such wonderful nature. It's like nestled surrounded by mountains and so much greenery. And the moment we entered in this campus, we were like, wow, is this even India? Because in Mumbai, staying in Mumbai, we are used to these cramped colleges filled with people and so many patients everywhere. The conditions are not great. They are much better now than what they were during our times. But I think, like Dr. Amirta Ganesh clearly said, that the change has to start from us. We cannot look at other people and cannot depend on other agencies to do stuff when we ourselves can make the change. Thank you so much. Looking forward to the talks.